Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Aubuchon.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi, everyone. Welcome to the Egg Whisperer Show. I'm Dr. Amy, your host, and I'm so excited to have one of the world's experts in PCOS on today's show, Dr. Mira Aubuchon. Hi, Mira.
Hi, Amy. Thank you so much for having me.
Thank you. I know you're super busy, so the fact that you're giving us this time, we all truly appreciate it. So why don't you just start off and let our audience members know where you're from, where you went to school, and I'm certainly going to have a lot more questions for you.
I grew up in Wisconsin and went to Northwestern University for medical school in Chicago, and then I came to St. Louis to do my OBGYN residency, and then I went to Albert Einstein College of Medicine in New York to do my reproductive medicine fellowship.
And where can patients find you now? Tell us about your practice, the name of the practice, how patients can find you.
I am in a suburb of St. Louis called Chesterfield in Missouri. Patients can find us by going to our website, which is www.mcrm.com.
And what made you go into medicine, and specifically fertility medicine?
I think that I was just drawn to medicine from childhood. I can't remember ever a time not wanting to be a doctor. And then when I went to medical school, I really thought that I was going to go into psychiatry. And then I did my OBGYN rotation and fell in love with the patients. And then I did my reproductive medicine rotation, and this was back in the 1990s when IVF was very new in this country. And I just thought it was the most fantastic thing I had ever seen. And then the ball went rolling from there.
Well, I'm glad you have just about as much passion as I've seen in anybody. And you and I share that because I, too, wanted to be a fertility doctor from the womb. So I can relate to that passion. So the subject of today's show is everything you need to know about PCOS from the expert. So I just want to start off with some of our questions. What do you think is the biggest misconception about PCOS that patients have?
I think the biggest misconception, well, I have a few. Is that all right?
Oh, please.
So one of them is that it only happens to people that weigh more. And really, PCOS can be present regardless of body weight. So that's one thing I hear a lot. Another thing that I hear a lot is sometimes patients will experience pelvic pain, and they're told on an ultrasound that they have very large cysts on their ovaries, and then they're labeled as having PCOS after that, and that's not necessarily the case. And then finally, I get told a lot that pregnancy just won't happen if you have PCOS, and that is a very sad myth because so many patients can have families.
It's hard because they're sometimes told that when they're like young, like 10, 11, 12 years old. And it's heartbreaking to see patients that are now 30 who feel like they've been told that they could never have kids for 20 years until they meet us. And we're like, that's a myth. Yeah. What are some of the causes of PCOS?
Multiple factors, but they include genetic factors, which don't always run in families the way certain genetic diseases do, like cystic fibrosis, for example, has a really, like you can almost do the math and figure out who's going to have cystic fibrosis in a family. PCOS is different in that there are genes that cause it, but it's a wide variety of genes, and it may be different depending on ethnic background. But still, the PCOS runs a lot in families. It also has to do with the hormones that even when a woman is a baby inside of her own mother's womb, the hormones that she experiences there play a role in whether she'll actually have the symptoms later in her life. And then finally, there's environmental, the air we breathe, the water we drink, but also body weight and lifestyle. And so all of those factors come together, and so some people may have some of those factors and never have the condition at all, and other people might really encounter all of them, and we see a wide variety.
What do you think is the most helpful way to get an accurate diagnosis?
The first step is just visiting the doctor and just talking about the symptoms. Sometimes the symptoms are really point to make the diagnosis pretty obvious, and then to flesh out that may in fact be the case, then we do some very simple blood tests. And then if the patient can tolerate it, an abdominal ultrasound, which is an ultrasound on the tummy with the bladder being full, or if the patient is of an age where this is appropriate, then an ultrasound in the vagina, a very simple ultrasound to take a look at the ovaries. And so some combination of those can reach the diagnosis very quickly or rule it out.
Yeah. And then talk us through treatment. Like, how would you treat someone who's not trying to get pregnant with PCOS, who, let's say, has problems with hair growth or irregular periods?
With the irregular periods and the hair, a very simple treatment to start with, if the patient is agreeable, is to just try a simple birth control pill. These are very inexpensive, and most of them work very, very similarly to reduce the symptoms of hair and to give people more regular cycles. And if after a few months, if that isn't working, then we can add in medications on top of that.
What are some of the medications you would add in, for example?
An example would be spironolactone or aldactone. This is used to treat blood pressure. It's very, very inexpensive, and it's not specifically used per the Food and Drug Administration to treat these types of symptoms, but it's been used for many years very effectively, and so we use it very commonly. And we start out with a fairly low dose and make sure that the patient can tolerate the side effects. Usually patients tolerate it really well, but they just have to be watchful that they don't get too dehydrated. And then every few weeks to months, just do a simple blood test to check the electrolyte balance in the blood and make sure that looks okay.
Great. So let's say you have a patient with PCOS who is now trying to get pregnant and her cycles are really irregular. What would your approach be?
I just wanted to clarify, she's trying to get pregnant?
Now I have a new scenario. She's now trying to get pregnant. Yeah.
Okay. So with irregular cycles, I get a sense for the patient's circumstances. So she's relatively young, and young meaning, we're all young, but I would say if she's in her early 20s, mid-20s, she has not been trying for very long, and she has some characteristics where if we just did some simple types of treatments that may work. It may be as simple as just a little bit of body weight loss. So even a 5% loss of body weight may be enough to jumpstart somebody's menstrual cycle and really isn't too expensive. For people where maybe that's kind of a hard thing to do, and if they've tried that and maybe they're not having much luck, or maybe they did and their cycles are still irregular, then there are medications available by prescription, and the the treatment that I like to use as a first-line therapy is called letrozole. And this is also used in what we call off-label, meaning that it's actually used to treat breast cancer. But it's been used for many years to treat people with PCOS, to help their cycles become more regular and to help their bodies do something called ovulation, which is where they release an egg. So it's a pill that they take for 5 days, and then that can be very helpful to help them ovulate, and I like to start with that. Sometimes I'll add in some medications with that, such as diabetes drugs, such as metformin. I don't give those to everybody, but some people may benefit from using that.
What kind of side effects do you see with the metformin? And do you have, with all your experience, any tricks for people who are listening to deal with the side effects so they're not as bad?
In terms of the side effects for the metformin, the main side effect is tummy upset. So queasy stomach, nausea, diarrhea, very, very bad diarrhea sometimes. Obviously, it's very unpleasant, and many people just are not able to tolerate it. And in the past, maybe about 5-8 years, the metformin has been formulated to be available in what's called an extended release form. So it gets absorbed through the body slower, so slowly that sometimes the capsule is the patient passes it in their bowel movement. It's still getting into the patient, but it's just passing through slower, and many patients find that much easier to tolerate. Other things that I tell people to do are to take it with a meal, which can be helpful. And I have them play around with the dosing to either take it just at night or take it in the morning or space it out. Every scenario is a little bit different for how people tolerate it. Most of the time, people tolerate it okay. Every once in a while, no matter what we do, it's not a good fit for the situation, and we just have to think about something else.
Okay. And then are there any specific supplements that you put your PCOS patients on?
Especially when they're not able to tolerate metformin, and I think that they might benefit from using something similar to metformin. I like a product called myo-inositol. It's often combined with D-chiroinositol. It's in this ratio called 40-to-1 ratio, and so the myo-inositol comes as a powder, and it can be taken once a day or twice a day. The D-chiroinositol sometimes comes with it or separately, and I let the patient know specifics of how I want them to take it. And this has been found to give some similar benefits in terms of if people have some difficulties with their insulin or diabetes control, and in terms of ovulation, it may be helpful. That it's not all that helpful as a standalone treatment, so I usually use it in conjunction with other treatments. But I don't usually give it plus metformin together. I'll pick one or the other.
Got it. And then what about diet? I'm sure your patients ask you a lot about the best diets that they should follow, especially when they have PCOS. What is your advice?
I have looked at so many diets, and I've published I've written some research papers on certain diets, but honestly, I don't really have a set diet. It seems like the best diet that is helpful is the one that the patient can stick to. And so typically that's a diet lower in calories, but oftentimes it's just simply a diet that they can follow without feeling so deprived that they overeat, and that kind of that minuses out all the benefits that they had originally. So the diet I've been recommending lately is what's known to many people as more of a Mediterranean style diet. And this can come in many forms. There's not just one set Mediterranean diet, but the one that I like to recommend allows plant-based type of beans, lentils, chickpeas, that type of thing, along with poultry and other meat if people eat those things, and then fish or fish oil, and then antioxidant-rich fruits and vegetables. And antioxidants are compounds and nutrients that we can take in through our food that help our bodies be healthier. It helps our bodies fight off infection. It helps with inflammation. And inflammation is a big part of PCOS, and so that can be very helpful. I also tell patients to try to decrease sweets that can sometimes be hidden. Coffee in your tea, for example. Not to say they shouldn't ever do that, but just to be mindful of what they're eating and drinking, and to try to reduce some of their sugar intake, because PCOS, even when people weigh, the weight is normal, can still be very sensitive for inflammation when they eat meals that are high in sugar. And so that's something that they can start to reduce. Whole grains are very good. And then plant-based oils, olive oils, have also been found to be very beneficial. I try to recommend diets that I would myself eat. And so I figure if it doesn't taste good, there's not much motivation to stay on it long term.
Yeah, that's true. And what about this question? Do you think PCOS is treatable? I mean, no one wants to be labeled as having something. I think it's hard for a lot of people to hear it. I think it's important because knowledge is power. Once you know what your diagnosis is, then you can build the team around you to support you and get the care that you need. But do you think that there is a way to actually treat it and be cured, I mean to say?
Yeah, and I think that is one of the myths and misconceptions about PCOS, is that it can be cured, and unfortunately it can't. This is going to be something that people are born with. It's a condition that's present even before birth. And there's no way to, even though the word ovary is in the name, it really is affecting just about every organ in the whole body. And so unfortunately, there's not a way to make it go away. But out of all of the reproductive conditions to have, this is a condition where we have multiple ways to control the symptoms and to help the person with their goals. So if those goals are fertility, we can help with that. In very, very rare cases, is this just an issue that is beyond help? Usually we can treat the hair, we can treat the fertility, we can treat the menstrual cycles. It used to be just, it was a condition that we had nothing to offer, and now it's more like we can easily treat those conditions. Now it's more like, how do we help patients live as long, healthy lives as possible, even when fertility is behind them. Now they're in their older age, we want them to live healthy lives just the same as everybody else. And I feel like that's a condition, that this is the point that we're in now with PCOS, that patients now live the same long life that everybody else does. And I think we've come a really long way.
Very true. So let's say in pregnancy, what particular risks does a patient with PCOS have in pregnancy compared to someone that doesn't have PCOS? Is her pregnancy higher risk? Like, should her OB/GYN know that she got pregnant and she had PCOS before? Would it change her pregnancy management at all?
I think that PCOS patients do have higher pregnancy risks, but overall, I think we have to be not unnecessarily alarmist, because I think most people with PCOS who are pregnant do fine. But there are somewhat increased risks of things like diabetes during a pregnancy, and so the OB/GYN would be told, I would tell them about the PCOS diagnosis so that they can be screened early on for diabetes. Blood pressure issues can also come about during pregnancy, like preeclampsia, which is a condition that involves high blood pressure during pregnancy, and sometimes patients have to have special care during their pregnancy to help with that. There might be a somewhat increased risk of miscarriages with PCOS, but that is a bit more nebulous in terms of pointing to PCOS as a cause for most of those. But I would say I wouldn't necessarily tell somebody that just because they are pregnant with PCOS that they automatically need to see a high-risk OB doctor. I would think that the vast majority of generalist OBGYNs would be able to care for them well.
That's very reassuring. So based on the fact that you're on the cutting edge, you have your pulse on everything PCOS because of all the research and all the articles that you've done. Do you predict any future treatments out there that women with PCOS should know about?
I think the most exciting thing that I'm waiting for more data to come out is the whole issue of the bacteria in our gut. So this is really exciting because it's being looked at for just about every disease you can imagine, not just related to the reproductive system, but to even our brain health and our heart health and so many things. And for in terms of weight and weight loss, and I feel like some of my patients that have PCOS, some of the myths and misconceptions that they come in with that they're being told is that it's their fault somehow. Like if they just did X, Y, and Z with their diet, they would lose weight and everything would be fine. And what they're finding out, what this research is finding out is that some of this is so beyond our control. It even comes down to the bacteria in our intestines that are also controlling our appetite and controlling our hormones. And so I think that a lot of exciting things are going to come out of research being able to pinpoint which bacteria do certain things. And if we know that, then we can take probiotics and tailor them for particular health issues. So that's one of the things that I'm really watching closely.
Okay, well, when the time comes, you have to reach out to me and we'll do a show just on that, because I imagine a lot of people will be very interested in learning more. So if you had an audience full of just PCOS patients, what is the one thing you would want them to know?
You are not alone. Even though from my perspective, I feel like I see so many PCOS patients, they feel like they're the only ones that have this. They feel so isolated. They feel like these symptoms are so unusual. Nobody else in their circle has these. And I would tell them this is so common. It may not be as talked about and as public maybe as some other types of conditions are, but it is very common, and things have gotten to the point, medicine-wise, science-wise, where it is now possible for people to live normal lives and have this condition with not too much being that they have to do to control it. So even though they may be scared, we're now at a point where we can help them live their best lives healthfully and give them the families that they desire, and that it shouldn't be something where they lose hope.
Thank you, Mira. Well, thank you again for being on today's show. I really appreciate it. Tell us again, where can patients find you?
The best way to find us is through our website. I work at MCRM Fertility, so if they go to www.mcrm.com, then they'll find us. or mcrmfertility.com.
Excellent. Well, thank you again. For everyone watching, I hope you'll tune in next time. Please hit subscribe on my YouTube channel and sign up for the IVF class or Tushy Method class at eggwhispererschool.com. Bye, everyone. Have a great week. Bye, Mira.
Bye.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Aubuchon.
And you have yet another success story
Just launched by an East Bay fertility doctor.